Christine Tyler, summer semester 2025. I'm doing a head to toe assessment on my daughter Tessa. She's over 18 and she will sign the consent forms. Hi, how are you?
Good, how are you?
I'm Christine. I'm going to be your nurse today.
Okay.
Can you give me your name and date of birth?
Tessa Tyler, 7/10/98.
And do you know where you are?
Annapolis Medical Center.
And do you know the president?
Donald Trump.
You're alert and oriented times 4. That's great. When I came in, I noticed that you were walking back from the bathroom and your gait was good and you seemed steady. Do you
Yes.
feel comfortable walking?
Yes.
Great. I like to hear that. So first, what I'm going to do is wash my hands and put on some gloves. And then I'm going to take your vitals. And after your vitals, I'm going to do an assessment. A head-to-toe assessment. I'm gonna ask you some questions. Some of them might be a little silly, but it's all part of the head-to-toe. Okay? All right. So let's do your vitals. Blood pressure is 120/80. Temp is 97.7. Pulse ox is 99. And respirations are 12. All good signs. Are you in any kind of pain?
No.
No pain. Great. Love to hear it. So 0 out of 10 pain. I see that you're hooked up to an IV. Your IV is running good. It looks like normal saline at 100. All your tubes are running fine. There's no kinks. You don't have a Foley. That's good. So you're here for dehydration. So are you feeling better than you were when you came in?
Yes.
Great. So I'm going to start your head to toe. I'm going to start at the head and work my way down. So first I'm going to just take a look at your scalp and make sure there's nothing going on there, okay? You just like to make sure there's nothing red. There's no sores or anything like that. Everything looks great. I'm going to take a look in your ears. Your ears have no drainage, no redness. Look at your nose. Can you open your mouth? Is it nice and moist? Okay, I'm going to take my pin light and I'm just going to take a look at your eyes to make sure they're reactive to light, okay?
Okay.
Both eyes are reactive. That's great. So I don't see any sores or anything on your face or inside your mouth. Your teeth are all there. Everything looks good. So right now I'm just going to ask you some silly questions, okay? I need you to raise your eyebrows, puff out your cheeks, smile really big, and frown. Perfect. So your face is symmetrical. Everything looks the same, which is what we want. We don't want to see any kind of drooping. Okay, I'm going to listen to your carotid artery. That's great, nice and bouncing. Everything looks good. How does this feel? Does it all feel the same?
Yep.
Good. Okay, I'm going to listen to your pulse, your radial pulses. Your CRTs are less than 2 seconds, which is great. Can you pull toward me? Push away. There you go. You have great strength on both sides. It's equal. Okay, I'm going to take a listen to your heart, okay? So I'm going to have to go underneath your shirt because that's how I listen better, okay? So I'm going to listen to your aortic valve, which is over here, the second intercostal. Then I'm going to come to the other side bilaterally and listen to your pulmonic. Then I'm going to listen to the tricuspid, and I'm going to come down and listen to the mitral valve at the fifth intercostal space, okay? listen for 1 minute. You have a nice strong heartbeat. Now I'm going to take a listen to the bilateral sides to listen to your respiratory between 6 and 8 intercostal space, okay? You just breathe normal for me. Okay, it sounds good. Now I'm going to take a listen to your stomach.
Okay.
And can you tell me, are you in any pain on your stomach or not?
No.
Okay, your stomach looks great. There's no distension. There's no signs of redness or wounds, which is good. So just take a listen. I'm going to take a listen to all 4 quadrants, okay? Going to palpate a little bit. You let me know if there's any pain when I'm pushing or pulling away, okay? Okay, your stomach is soft and non-tender, which is great. It's a good sign. Your skin on your upper extremities is nice and warm. It feels nice and there's no abrasions or skin tears or anything of that sort, which is good. That's what we like to look for. Okay, so I'm going to go down to your lower extremities now, okay? And same thing that I did up on your arms. I want you to tell me if it feels the same on both sides as I go down your legs, okay?
Okay.
You feel the same?
Yes.
Yes, okay. And you're just going to feel your pulses. Pulses here. All your pulses are bounding. They're nice and strong. Can you push against my hands and away? Okay. You have some good circulation down here in your feet also. Your heels look nice and they're blanchable, which is great. Don't want any kind of pressure ulcers. That wouldn't be good. Normally I would take a look and make sure there's nothing underneath your clothing, but it looks like your skin's in perfect condition, which is great. If you could just swing your feet over so I can take a listen to your back. I'm just going to take a listen at the second intercostal space right below the scapula. And I'm going to do this underneath your shirt, okay? Can you take a nice deep breath for me? Again. Great. And I'm going to come down between 7 and 10. And can you take another deep breath? And one more. Great. Your lungs are clear, which is perfect. You do not have any kind of wounds. Your skin is nice and warm. It feels great. You can go ahead and lay back. So with my assessment, you're oriented ×4. Your skin is nice and warm and pink. There's no abrasions, which is great. Your vitals are within your limits, is what we like to see. Other than your dehydration, it seems like everything is going well. So we'll continue doing normal saline at 100, which is probably going to run for a little bit longer until you're more hydrated and you're feeling yourself again. Okay? Everything looks great though.
Awesome.
Okay, you have a good day.
Thanks.